When people snore, most of us assume they're getting the best night's sleep of their lives, but it might be the opposite. From surgery to CPAP and sleeping sitting up, people have tried various things to address the problem. But our next guest has a customized option that's convenient and easy to work with. He actually uses it himself. Dr. Schleicher is with Sleep Houston. They help people to get quality sleep. All right. So when it comes to dentistry, it was interesting. You're the first person that I've ever met that specializes in sleep dentistry, but I didn't know anything about that.
Well, sleep dentistry is basically treating obstructive sleep apnea from a dental perspective. Specifically, we use oral appliances to open the airway naturally instead of having a CPAP blow through your airway like a leaf blower on your face to get you to breathe. So it's just much more comfortable for the patients.
Yeah, so when you say sleep apnea, explain to people what that is. And a lot of people aren't even aware they have it.
Sure. Well, we know 40 million Americans have obstructive sleep apnea. That means sleep without breathing. So in the middle of the night, while they're sleeping, they will actually stop breathing because their airway will block right here. Usually their tongue or their upper airway will collapse. They'll actually stop breathing 50, 30, 50, 100 seconds per night, multiple times during the night, and it interrupts their sleep. They have fragmented sleep, lack of oxygen to their brain, and this causes all of the symptoms and comorbidities that we know are associated with obstructive sleep apnea.
Yeah, because there are people who actually passed away with related to sleep apnea.
Well, we know now that coronary artery disease, heart attack, stroke,
weight gain,
dementia, weight gain, all these things are intimately related as a negative consequence of not treating obstructive sleep apnea. So it's really a life-threatening type of an illness, but there's no outward effects other than patients feel tired, they feel fatigued, they feel like they don't have refreshed sleep, they have brain fog. These are all symptoms that, hey, they're not getting the oxygen they need during the night when they sleep.
Yeah, and we mentioned it causes problems at home.
Well, I got into this about 25 years ago by accident. Yeah. I actually got banished from the bedroom. I was snoring so loud, my wife played a tape recording of it at breakfast and said, "This is you." I said, "That can't be me." And my son says, "Yeah, Dad, that's you."
Yeah, that's the crazy thing is that oftentimes you're not aware of it, but you're keeping other people awake as well. All right, so CPAP is one of the things that came out for people to address it. And this, you can just look right here. All right, this machine, first of all, is on your nightstand. It limits you in terms of how far you can toss and turn in the bed or whatever. And then you have this over your this isn't, no. I have a few friends who I've seen theirs. It's on the floor someplace or it's in a drawer someplace and they just don't use it. So they're not taking care of the issue.
Well, we know CPAP is the gold standard. Yeah. It always has been the gold standard. And that is in the lab. It works better than anything. But in real life, 60% of patients that are prescribed CPAP don't use it, quit using it, it's in the closet, or they put it on for an hour and then take it off. So it doesn't matter how good it works if the patients aren't using it.
Yeah.
So oral appliances, which what we do as dentists, these open the airway naturally by basically, your tongue is attached to your chin right here. If we move your chin forward, we move your tongue off the back of the airway. So we're able to open the airway naturally without blowing it open by wearing a simple oral device that holds your tongue in a forward position.
Yeah.
Very comfortable. Instead of 30% compliance, we have 95% compliance with people that wear this. They put it in, they wear it all night.
Yeah.
Not an hour, not 2 hours, or it's not, these don't go in the closet. Patients feel great when these are in their mouth.
And it's just not obstructive in the whole, scenery of the bedroom, right? But the other thing is that there are some things that we've seen, like people can just order your appliance online. This is custom fit to your mouth. Anything you order online is not going to be custom fit to your mouth.
Right. These are very comfortable. My job is to make this comfortable, make patients love this, and make it open their airway without going beyond the adaptive capacity of their jaw joint. But we scan the patients with a computer. This is sent to the lab and is made specifically for their mouth, for their arches. So these are super, super comfortable.
Yeah, who should consider this?
Anybody that's having a problem with their CPAP, if you're frustrated with those hoses, if you're frustrated with a mask, if you're not wearing it consistently each night, and if you're just tired of flatlining through life and want that energy, you want the vitality back to live your best life, come see us. Get one of these, and it's going to make all the difference in the world.
Yeah, and to be clear, this is a true medical device.
This is a medical device. It's covered by most medical insurances. It's covered by Medicare. It's as the American Academy of Sleep recognizes this as the first level of treatment for patients with mild to moderate sleep apnea. If you're severe, you should stay with your CPAP. But even those folks that are severe, we're able to help because if the CPAP's in the closet on the floor, this is better than nothing.
Yeah, and how quickly do people realize a difference?
Well, that's something that's amazing. Usually the first night, they don't have to wait a month. Usually the first night, they start to feel results. And we will monitor them for up to 6 months to make sure they're at the proper setting before we send them back to their sleep physician or to their medical doctor for long-term monitoring, because this is something that they'll allow you to monitor their whole life.
Yeah, all right, I'll back up in the process for a second. So when they come in, the first thing you like to do is to pinpoint whether sleep apnea is their issue, right?
Oh yeah, we'll check. We'll work directly with their doctor, with their MD, or their sleep doctor, to find out, first of all, how severe they are, and if it's appropriate, we'll order the appliance through their doctor. And then we will start the process, and usually by about month 3, we would send them back to their doctor for a follow-up sleep test to make sure that this is actually working for them.
Yeah, all right. Sleep Houston is offering a special promotion today. If you call now, each patient will receive a flash drive with a copy of their CT scan of their airway and TMJ, and that can tell their doctor a number of things, right? With
Yeah. We send that CT scan back to their doctor, back to their pulmonologist, back to their ENT, so they'll have that record. They won't have to take another one. They can have the one we took for them at the office.
All right. This is a $250 medical grade image you can share with other physicians, like you just said, like your ENT or internist, anyone. If you're ready to get quality sleep and get out of the guest room or off the sofa, make an appointment with Dr. Schleicher today. You can contact Sleep Houston at 713-828-8587. Again, that number is 713-828-8587. Visit their website at sleephouston.com, or you can scan the QR code on your screen right there.